Hello everyone, and welcome back to MediInsights, your trusted source for all things related to health and wellness. In today's video, we're diving deep into Sotrovimab Injection, a groundbreaking monoclonal antibody treatment designed to combat COVID-19. We'll be exploring its uses, recommended dosage, how it works in your body, the potential side effects you should be aware of, and some crucial advice to consider before using this medication. If you're looking for expert insights on this vital treatment, you're in the right place. Let's get started. Use of Sotrovimab Injection. Sotrovimab injection is primarily used as a treatment for mild to moderate COVID-19 in patients who are at high risk of progressing to severe disease, including hospitalization or death. It's particularly beneficial for individuals who have underlying health conditions that make them more vulnerable to severe COVID-19 outcomes. By targeting the spike protein of the virus, Sotrovimab helps to neutralize the virus, reducing the viral load in the body, and preventing the disease from worsening. Next, dosage of Sotrovimab injection. The recommended dosage of Sotrovimab injection is a single dose of 500 mg administered as an intravenous infusion over 30 minutes. This one-time infusion should be given as soon as possible after a positive COVID-19 test and within 10 days of symptom onset. It's important that the infusion is administered by a healthcare professional in a setting equipped to manage severe allergic reactions, including anaphylaxis. Next, mechanism of action of Sotrovimab injection. Sotrovimab is a monoclonal antibody that specifically targets the spike protein of the SARS-CoV-2 virus, which causes COVID-19. By binding to a conserved epitope on the spike protein, Sotrovimab prevents the virus from entering and infecting human cells. This action helps to neutralize the virus, thereby reducing its ability to replicate and spread within the body. This mechanism not only helps in controlling the infection but also in reducing the severity of the symptoms. Next, side effects of Sotrovimab injection. Common side effects of Sotrovimab injection include mild to moderate infusion-related reactions such as fever, chills, dizziness, headache, and rash. Some patients may experience gastrointestinal symptoms like nausea or diarrhea. Although rare, serious side effects such as hypersensitivity reactions, including anaphylaxis, can occur. It's crucial to monitor for any signs of an allergic reaction during and after the infusion. Next, important advice for using Sotrovimab injection. Before receiving Sotrovimab, inform your healthcare provider if you have any allergies, especially to medications, or if you have any underlying health conditions. It's also essential to understand that Sotrovimab is not a substitute for COVID-19 vaccination but rather an additional tool in managing the disease, particularly in high-risk individuals. The timing of the infusion is critical. The sooner it is administered after the onset of symptoms, the more effective it is likely to be. Always follow the guidance of your healthcare provider regarding the use of this medication. By the end of this video, we hope you have a clear understanding of Sotrovimab injection, its uses, and what to expect. If you found this video helpful, please like, share, and subscribe to MediInsights for more expert content on health and wellness. Stay informed, stay safe, and we'll see you in the next video.